No Flu at EIU, an educational video brought to you by the Eastern Illinois University Health Education Resource Center.
I just heard about the flu shot day this October, and I know we're offered it every year, but I never get a flu shot, my friends never get a flu shot, and we never get sick. I just don't think it's worth the risk and side effects that it causes.
Hi, I'm Dr. Sheila Simons, and I am a professor in the Department of Public Health at Eastern Illinois University, and my specialty is epidemiology, which is the study of diseases. It's important to know that the vaccine contains a dead virus. It is not live influenza, so you cannot get influenza from the influenza vaccine. It's not possible. Again, it's a dead virus. And with the vaccine itself, there are some side effects that some people experience, and a lot of those may be some redness at the site of the injection itself in the arm. You might feel a little feverish, a little warm. Sometimes people will report some body aches. And again, that's all part of the normal immune response. And that is just really showing that our body is working with the vaccine itself and starting to develop antibodies to it, which in the long run help to protect us against that. One thing that we should note is that vaccines aren't 100% effective, right? But what we know about the influenza vaccine is that even if you do get the vaccine and you do develop influenza, your case of influenza will not be as severe as it would have been if you didn't get the vaccine. And while you may think that you have never been sick with influenza, what people should realize is about 30% of the population or 30% of our influenza cases are asymptomatic, meaning individuals don't have any signs or symptoms, but yet they're still giving it to other individuals.
Getting the flu shot is my choice. I'm the one who's taking the risk of getting sick. The flu isn't that dangerous anyway, is it?
My name is Amanda Harvey. I'm the academic advisor and instructor in the Department of Public Health. I'm also a certified health education specialist. By not getting the vaccination, individuals are putting compromised populations at risk. So for example, I had a baby a few months ago, and he cannot get the vaccination until he's 6 months old. So myself, my 4-year-old, and my 2-year-old get the vaccine every year to not only protect ourselves, but for other individuals around us. So this year, we're protecting their baby brother. The difficulty with identifying compromised populations is that it may not be obvious. So there are multiple diseases and disabilities that we may not be able to actually see that they're actually compromised. Some individuals you may not think about are your grandparents. Older individuals are at higher risk for complications with the flu. While getting the flu may not be dangerous for me and you, there are a number of populations that may have serious effects related to the flu.
If the flu is that big of a deal, wouldn't my doctor tell me to get a flu shot? I've had the stomach flu before and it wasn't that bad.
I'm Becky Ogle. I'm a nurse practitioner here at EIU Medical Clinic. I'm one of the people that you'll see whenever you come in and you're not feeling so well. One of the common misconceptions is that the influenza, the flu, is comparable or the same as the stomach flu. The stomach flu is very different. The stomach flu is actually strained from a different virus. But as far as the flu itself, it's kind of what we call an all-encompassing. It's a full body illness. Typically you will start with a fever, general fatigue, body aches, muscle aches, just a general feeling of bleh. They may have congestion, runny nose, sore throat, They may even have nausea, vomiting, and diarrhea. That is more rare, but it is possible. It is all encompassing, whole body. And oftentimes people say, well, I have all the symptoms of the flu when they're comparing the stomach flu to influenza. So it's just really important that you kind of learn to differentiate the two. They're both viruses. They are both treated symptomatically. We do not treat the illness. There is no cure for either of them. One of the common questions is, do I get the flu shot? The vaccine is important for everyone. If you're on campus, you're in close quarters no matter what. And so it's super important that we really bring home the fact that it is necessary to get the vaccine.
If you experience any symptoms of influenza, please contact Health and Counseling Services immediately at 217-581-3013. Please call and make a same-day appointment. Due to social distancing guidelines, walk-in appointments will not be available. If you have any questions or concerns regarding influenza or the flu shot, please text FLU to 52855 or make an appointment with your healthcare provider.
Taking all the precautions doesn't always make everything 100% okay, but it makes it a heck of a lot more likely that you're going to be healthy and then therefore not passing it to other people.
Hello, I'm Dr. David Glassman, President of Eastern Illinois University. This year we've been made well aware of the impact a virus can have on our community. I'm urging all of our faculty, staff, and students to be sure to take a flu shot this October. Together, we can help keep EIU safe and healthy. Thank you.
The Eastern Illinois University Free Flu Shot Day will be held on October 14th from 9 a.m. to 3 p.m. for both students and faculty. Please monitor your Panther Mail and the Health and Counseling Services website for updates on the location of the Free Flu Shot Day. To receive text message reminders about the Free Flu Shot Day and its location, text the word flu to 52855. Remember to bring your Panther card to receive your free flu shot. When attending the Free Flu Shot Day, please wear a mask or face covering and practice social distancing.